The Healing Spring Show, healing families and communities by breaking the stigma of addiction and expanding the scope of recovery. Now here's your host, John Edmonson.
Welcome back to the Healing Spring Show. Welcome back because we have a very special guest today. We're going to talk about how trauma can affect our body, our mind, our spirit, and maybe even an influence in many of the diagnoses we receive in the mental health field. How does it connect to addiction? How does it connect to us reaching our full potential? Today we have Melissa Caldwell Engle. Now she is the clinical director at Healing Springs Ranch. Now she's also one of the people that formed the ranch itself. It's part of a vision to help people reach their full potential, work through their trauma, and have a happy life. Melissa, thanks for being on the show today.
Thank you.
Yeah, it's a true pleasure having you here.
I'm glad to be here.
So let's start off with the origin story of Melissa Caldwell Engle. How did you get started? What brought you into the field of psychotherapy?
Go all the way back?
Yeah, let's start a little bit back and then we'll work our way in.
Okay. So I was actually a fine arts major. I was in school, in college, studying fine arts, looking at commercial art. And I was bribed by a friend of mine to take the psychology class. I had no interest in it whatsoever. I took the psychology course, and while I was in the class, I realized how much I liked it, how natural and easy it was for me. And while I was in that course, that beginning psychology class, they had a section in our book on art therapy. And so I thought, oh wow, that's the merging of two worlds. That's two things that I really like that I could bring together. So that's really the initial, how I even got into this to begin with. Then I think just fate just kind of opened doors for me. I had an opportunity in my internship when I was an art therapist to work with Dr. Colin Ross, who is one of the leading authorities in the world on treating trauma. And his specialty was treating dissociative disorders. And obviously, if you're dealing with trauma, you're going to treat dissociative disorders, post-traumatic stress disorder. So I had a lot of experience in training, and actually went on to be his executive director, and we had about a 25-year career stretch with him. We still do a lot of speaking together. He's still involved at Healing Springs Ranch as helping us with our research. He's a fellow, but he's been a wonderful part of my cutting my teeth in this field. And I actually texted him just a couple of days ago telling him how grateful I was that he was able to share with me a different approach, because it's really that grassroots training that I had that got me so interested in the trauma model and understanding how trauma affects mental health, which I'm so grateful for today, because it's quite different than what the medical model really teaches and focuses on and trains people for. So I'm looking back in hindsight, I'm so grateful I had an opportunity to learn from someone who could think outside the box and could see a different approach that I think embraces more compassion, more collaboration with the client. It's a difference. It creates a different kind of energy in exchange with your clients. I think it's personally much more healing. It's much more connective on a human level, and it gets away. You don't spend so much time focusing on the pathology as you do looking at the commonalities. And I think that's critical for human development and healing. I think we heal through our connections, not our judgment, obviously. So the field of psychiatry and psychology, and even the medical field at times, can become very focused on describing what is pathological versus what is normal. And I think we get in a lot of trouble. And there's a lot of people that it's a disservice to people to come at it from what is wrong with this person as opposed to what is right with this person.
Let's talk a little bit about this. You named so many things which are really interesting that I think people are going to want to hear about. You said different approach.
Yes.
You said trauma model, and then focusing on what's good about people.
Right.
Tell us about that. You said this is actually different how other therapists might think or might perceive a client?
Well, and even I was trained, a lot of my training talked about looking at the pathology. And when you talk about the DSM, which is the Diagnostic Statistical Manual, which is the Bible of psychiatry, and it's not anything real fancy, and it's not anything real hard to do. You open it up, it has a diagnosis, and it has some criteria listed. And you have to meet so many of those criteria to get a diagnosis. And so it forces you to kind of look at, well, if a person meets these criteria, this is the diagnosis, and you become very focused on just behavioral symptoms to decide if they meet this diagnosis or not, if they have enough criteria to get this diagnosis. And there's nothing wrong with having a common language and having to give a diagnosis. But when it comes to treatment, if you're just focused on those behaviors, the unhealthy behaviors that give the diagnosis, you don't spend as much time focusing on the healthy aspects of those behaviors. And so people can't help but feel pathologized, and the emphasis is on what they're doing wrong and what's not healthy, instead of looking at maybe there's a reason for those behaviors, maybe there's a need for those behaviors, maybe there's something that would make sense, instead of just saying these behaviors are bad, they're unhealthy, we need to stop these behaviors. If we looked at what's causing these behaviors, how do these behaviors serve this person?
Right.
Is there actually a reason for the behaviors? And that shifts from being something that is unhelpful and needs to be stopped to kind of reframing these behaviors as something positive that we can build on, and we can reframe them. And that's a much easier jump for a person. That's kind of a bridge, as opposed to these behaviors are bad, stop them, to look at it and say, wonder what these behaviors do for this person, and how can we take the intention of these behaviors, but put it a different, be able to reframe it or redefine it, or give it a little bit different way of being expressed, because quite often those behaviors are what kept that person alive, and we miss that. They can be very helpful, they just need a different way of being expressed, they need to be redefined, and I think that's very powerful for people.
Yeah, so you're saying it's no longer just judging someone they're an addict or they're mentally unstable or unhealthy. Now let's just view them that way. You're saying that there's more to them than that.
Absolutely. A teacher I had in art therapy, her name was Dr. Nancy Knapp. She's no longer living, but she was very, very powerful influence in my life. And I remember she taught our class, and she said, ask yourself always, what problem does this symptom solve? What problem does this symptom solve? And she drilled that into our heads, and she said, don't judge the symptoms. And there can be stuff that we think, oh my gosh, I would never do that. I mean, people that, let's look at them. There's people that talk to people that aren't there, or there's people that after they eat, they'll purge their food up. There's people that will stick needles into their veins. There's people that pull their hair out. And you look at all these symptoms at a behavioral level. Like, look at that behavior. We tend to judge the behavior. But if you can look at what problem does the symptom solve, and start to realize it actually has a purpose, if you can look at the purpose and get to the root of why you need it, and start to deal with the need for that behavior, and start to heal, which is what I'm fixing to tell you, the need, start to heal the pain that behavior helps the person to escape from, then they don't need the behavior anymore. Or the behavior can be shifted into a more of a healthy outlet, as opposed to something that's destructive to yourself. So I think if we start from the mindset of, just like what Dr. Knapp taught us, what problem does this symptom solve? It's a very, very different dynamic than, oh my goodness, we need to just stop that behavior. Because stopping the behavior, if you don't get to what the purpose it serves, the behavior will crop up in another behavior. It will crop up in another behavior. So you see this all the time with people who stop drinking. They stop this behavior. But if they don't get to the root of why the person needed this behavior, if you don't get to the core of what that behavior, what problem that behavior solved, and for the person that may be drinking, it may be because there's a lot of pain, and when they drink, it kind of shuts everything down. They have a moment of peace, it numbs it out. If you don't start dealing with that pain, they can stop drinking, and they can even brag that they've had 3 years, 5 years, 10 years sobriety. But if they start smoking 2 packs of cigarettes a day, or they start acting out sexually, or they get addicted to pornography, or they start spending money that they don't have, you'll see these symptoms pop out. It's like whack-a-mole. You can stop this behavior. If you just focus on the behavior and you don't focus on the need for it, it's got to come out in some other area, because the need is still there. And that's what we see. And the same is true with mental health. When people have chronic mental health issues, I mean chronic, if I have a loved one die and I struggle with some depressive symptoms, that's expected, that's normal. But if it becomes chronic, and we're talking years are going by, and you're struggling with chronic depression, chronic anxiety, chronic bipolar symptomology, even chronic, what people would say psychotic or psychosis features, when we start struggling with chronic addictions, chronic mental health, I've learned, because I've been doing this for almost 30 years now, I have learned it's always about managing pain. The underlying problem that all these symptoms, and I'm including mental health criteria and mental health behaviors, those symptoms solve the problem of trying to manage pain, conflict, discomfort, uncomfortable feelings. It's always something emotionally anchored and rooted in that person that is uncomfortable and stressing. And all of these symptoms and behaviors help people take a break from that, distract from that. It sounds too oversimplified to say that they're just distracting themselves from their pain, but it's a way to manage the pain, whether it's through distraction, whether it's through, a lot of people get addicted to risk-taking behaviors. A lot of people get addicted to self-harming. You hear about people that cut or burn their skin, and there's actually endorphins that are released. And so you kind of get addicted to that rush. You get addicted to that feel-good place, because if you feel good, all the bad stuff goes away for a little while. So it's all about, how do I make the bad stuff go away for a little while? Getting rid of the pain, just even if it's a temporary distraction from it. And that's why a lot of people struggle with sleep. They have horrible sleep issues, because when you're busy during the day, all that stuff is at bay.
Off to the side.
But when you lay down to close your eyes and have to be still, all of those feelings that you have been busy during the day and have avoided, they start to come up. And so you see a lot of people with chronic mental health and chronic addictive patterns that have horrible, horrible issues with sleep. They cannot sleep, or they cannot stay asleep.
And when a lot of people that are watching this, some are clinicians, some are going to be, clients or future clients, or people that are going to get help in this world. One of the consistent things I hear when people start talking about addiction, either about others or themselves, bad people, I'm such a horrible human being, I can't be disciplined enough, I can work really hard and I can do great over here, I can be in great shape, but I can't manage this addiction over here, I'm just a bad person. You're saying it's actually something different then. It's not character flaw or defect.
Correct.
Or they may have some. It's not just innately bad human being, but there's something else going on they're trying to avoid or trying to manage.
Yes, and I've seen that consistently for almost 30 years. I've seen it over and over. And it's just like if you cut a weed down at the root, we all know if you cut a weed down, what happens? It's going to pop up over here. It's going to pop up over there.
Yeah.
And we try to have mental health and addiction on these two separate poles, and I don't know why, because there's so much overlap. And so I gave the example of a person that stopped drinking and then they start smoking 2 packs of cigarettes a day, or they start shopping or acting out sexually. There's other things too. Their depression can go up. Their anxiety can go up. So there's a lot of mental health symptoms. You cut the addiction weed down, mental health symptoms will pop up. They're so connected. I think we're doing a disservice to try to treat addiction over here and mental health over here. And we're getting better, because we're talking about dual diagnosis now. We're talking about people are starting to recognize that sometimes there's some underlying mental health issues. So we're slowly getting there. But I would say if it's chronic, it's all the time. And it behooves us as clinicians to start putting those pieces together for our clients, so they don't just go from one addiction to a different addiction to a mental health issue to another addiction to a different mental health issue. It just continues and continues and continues. And the DSM itself kind of keeps us divided in our mind of how we look at diagnoses. This is this diagnosis, which is very different than this diagnosis, which is very different than this diagnosis. And that doesn't even make sense. If you broaden the definition of addiction to just be a pattern of avoiding pain, a pervasive pattern of avoiding feelings. So that's been my working definition of addiction for years. You can avoid feelings by going into rage. And it sounds funny to say it this way, but you can actually be addicted to your mental health symptoms. You can be addicted to depressive symptoms. You can be addicted to, like I said, being into rage. You can be addicted to paranoia. And I know this goes against the grain, because people get a little ruffled and they say, now hang on a minute. You're talking about mental health symptoms. This is all genetic. And that will be another show for you, because
That'll be the next episode.
Yes, and
genetics.
Get Colin Ross on here, because it's not that genes don't play a role in who we are. Of course they do. Genes always play a role. But unfortunately, in this field, it has been quite, not always, but more often than not, people describe genetics and they describe environment. And for those of us in the trenches working with our clients, if it was this big, why even go to psychotherapy? It's a genetic issue. There's not going to be anything you can or cannot do. What we've learned is it's genetics, because genetics are going to be a piece of this, but environment is the bigger piece. And this environment, you're part of my environment right now. What I eat is a part of my environment.
Right.
What I think is a part of my environment. Exercise is a part of my environment. What I take into my eyes, what I take into my ears, what I take into my body by food, that's all environment. And if we are putting toxic things in our eyes, in our ears, in our bodies, if we're thinking negative toxic thoughts, that's going to affect who we are. So that's why psychotherapy works, is we're trying to help people change the way they think. And then if you want to have like an integrated approach, which is what we're going to be talking a little bit about today, this is what we're talking about. The integrated approach says, well, let's look at all the things that's going on in this body, in this mind. Let's look at all the ways mind and body can work together in a fluid, healthy way. And that's going to require us to be healthy with our food, be healthy with our relationships, be healthy with our thoughts, be healthy with the people that we spend time with, be healthy in our ways that we connect with a higher power. So I think good well-being and helping people reframe behaviors. If someone's eating an unhealthy diet, educate them on what a healthy diet is. If someone is managing their stress in unhealthy ways, teach them healthy ways of managing their stress. If people have unhealthy thoughts going on, teach them healthier ways of thinking.
Mm-hmm.
If people are staying in unhealthy ways of emotional expression, teach them what healthy emotional expression looks like. And so I don't say anymore that all feelings are okay. That's what I learned in graduate school. All feelings are okay. That's not true. Not all thoughts are okay. If I sit here and tell myself a lot of negative thoughts and belittle myself and put myself down and criticize myself, if my internal critic constantly is commenting,
yeah, it's running and going and
constantly commenting, that's going to affect how I feel about myself. That's going to affect, obviously, my thinking. It's going to affect my feelings. It's going to start affecting my body, because the more negative thoughts we have, it's going to affect us chemically. This has all been proven. So negative thinking, people will say, but is that genetic or is that chemical? I'm like, well, we've proven that negative self-talk changes who we are chemically.
Right.
Positive self-talk changes who we are chemically. So it's all about understanding all the different ways to have wellness and health in every area of our lives, so that we, to use your words, we live in a place of optimal living, optimal performance, optimal health.
Yeah, optimal self.
Yes.
Yeah. So the question that comes to my mind, I wonder if anyone else watching is thinking this. You say healthy. Mm-hmm. So healthy body, healthy mind, healthy lifestyle. And what I've noticed was, well, I asked the question, does that mean perfect? Like you never have negative, unpleasant feelings? You never have unpleasant thoughts? You never miss your diet? Is that what that means? And a lot of people strive for that.
Absolutely. And that can be a problem itself. It's called perfectionism, and it doesn't exist. And you set yourself up for failure. And many people that try to be perfect can't. I mean, what's the old saying? Without rain, you don't see the beauty of the sun. Without pain,
right.
I mean, it's kind of the prayer of St. Francis. You have to be able to look at the dark to appreciate the light. It's all part of life and being balanced. And to take that one step further, I think a disservice that I'm starting to see with the youth as they've grown up, because when you're doing this for 30 years, you start to see the children of the people that you treated 20 years ago. And so what I'm seeing is parents who are trying to give the best to their children and want to save their children from the pain that they may have endured, which is a beautiful thought.
Good intention.
But what happens is these families, or we, moms and dads, overprotect. And we don't teach our children. There's a book called The Value of a Skinned Knee. Mm-hmm. We don't teach our children how to manage discomfort in this world. The yin and yang is black and white. There's two sides, and they're balanced. We can't have one without the other. And there's nothing wrong with thinking, oh, I want my children to have an easy life, a good life. I don't want them to struggle and suffer. There's nothing wrong with that, unless you protect your children and you don't allow them to develop muscles. Because Emotional muscles are developed just like physical muscles. And we can have kids that are growing up and they do quite well when the environment is perfect.
Right.
But when life gets difficult or throws them a curveball, they become suicidal. They don't know how to manage that pain. And matter of fact, they think there's something wrong with them that they're feeling that kind of pain. So in a world of parents who are trying to protect children and make their lives better, I'll have parents say to me, isn't it my job to make my child happy? I'm like, no, it's not. It's your job to protect your child. We don't want to send them out in dangerous situations, but your job is to teach your child how to get back up when they fall also. It's not just about preventing the fall, it's about how to get back up after they fall. Because someday when you're gone and you can't create this perfect bubble around them, they're gonna fall. Life is gonna have curveballs and they're not gonna know how to address it or how to adjust to it. So I see a lot of kids that in regard to emotional coping skills, they don't have a lot of the most necessary ways, coping skills and abilities to manage their feelings because they've been overprotected and they don't know how to deal with discomfort. And so they rely on drugs, they rely on buying things, they rely on relationships, they look for external solutions to internal emptiness and pain. And so they think something out here has got to help this discomfort in here. And that's going to set us up for just this constant rotation of what's the next thing I can get my hands on to make myself feel better. And that will eventually play out. Materialism will play out. Substances will play out. Then you're going to see depression, anxiety, low self-esteem, self-hate. Suicide goes up because people don't know how to manage pain, and people don't realize that's a part of life too. So I think when you look at a society and we go through the depression, the first generation that kind of comes out of that depression, they have this balance with gratitude and pain because they've served their parents or even themselves have survived something very painful, and there's so much more appreciation and gratitude because they're kind of on the cusp of remembering the pain. And the more that we become industrialized and the more convenience we have in our culture, you think it's a good thing. And it can be. But what happens is people lose their ability to appreciate hard work. People lose their sense of balancing out. Part of what makes us have gratitude is remembering the discomfort and the strife and the difficulty. So there's a balance to having to work hard for something and having it given to you too easy. It teaches gratitude and values and appreciation, and that's part of self-worth, identity. These are key pieces that I see we are starting to lose sight of in our culture of convenience, and kids are growing up not recognizing the beauty and pain and the benefit of discomfort to becoming stronger. And then you see it spill out more with more and more people have addictions. More and more people have mental health issues. There's more depression, anxiety. We have suicide now. We're having to look at suicide with children the ages of 10 and younger. I mean, I don't think we're getting healthier emotionally or balanced as a culture the more convenience that we have.
Yeah, we may be getting a little bit more unhealthy because we don't know how to manage the problems that come our way.
That's what it looks like is happening.
Yeah. And you've actually helped create a treatment center that addresses this.
Absolutely.
Healing Springs Ranch. Can you tell us a little bit about this? How does all this play into addiction treatment, mental health, process addictions?
Yes. So in what I wanted to bring when I was asked if I wanted to be a part of Healing Springs Ranch. So I'm an owner, I'm a founder, I'm a clinical director, I'm involved with the clients, I'm in the milieu working with the clients. And what I wanted to do different, my work with Dr. Colin Ross and his trauma programs, which are still in existence today and are phenomenal programs, my work with him really laid the foundation because I learned not to focus on the diagnosis. I learned to look at when people have pain, aka trauma, when there's unresolved pain, you can have a treatment program that all of these people can come and be a part of. One person can have a diagnosis of major depression, someone else with PTSD, someone else with a dissociative disorder, someone else with alcoholism, someone else that is addicted to methamphetamine, someone else that struggles with psychosis. You can have all these people in one room, in one group, working together because what they had in common was they had traumatic things happen to them. And it really makes you get away from all the behaviors, because you could have people saying, well, how can I benefit from that person? Because I'm not anything like that person. That person hears voices. That person vomits up their food. That person shoots up. I just smoke a little weed. I don't really fit in with this
I'm
group.
good. Yeah.
I don't belong here. And what I would tell people is, listen, everybody in this room has had pain. Everybody here's got a lot of suppressed pain that they've never dealt with, that they're trying to manage the best of their ability. One person manages it with meth. One person manages it with their anxiety. I know that sounds strange to say it that way, and I'll explain more later or on the next show. But everybody in here is managing and manifesting their pain from different places. And if we focus on the behavior, you're right, you're all very, very different. But if we focus on, we're humans that have pain, that don't know how to manage it and are overwhelmed and are needing help to be able to resolve this pain in a way that doesn't cause us to need all these maladaptive behaviors and patterns, we're all in this together. And so for 20-something years, I ran groups with all these different people with different diagnoses, and you weren't in the program because of a diagnosis. It wasn't the key feature of why you're there. The key feature was the pain. Now, for insurance companies that understand what you're working on, you have to give a diagnosis. But the key common denominator was there's a lot of pain that the person doesn't know how to deal with. And when you focus your treatment on that type of recovery, on that type of commonality, everybody in the group could relate to everybody. They no longer saw the differences, and you did this and you do that and I do that and I would never do that. They're saying things like, I can totally relate to that. That would be very painful. I had similar experiences happening to me. So it really brings it down to a human level, and all of us can relate to, my heart hurts, I have a lot of grief, this is miserable to sit in this space by myself, I don't know what to do with it, I don't know if it won't just swallow me up. Every human, if you've lived long enough, has experienced grief and pain in that way, and it's the relatability is where recovery is. Recovery lives in relatability.
What does that mean, relatability?
Being able to sit with one another, understand that somebody else has been through this too, having connection, relationship, fellowship. There's a lot of people that say the opposite of addiction is not sobriety. The opposite of addiction is connection. And to help people realize, and there's been studies that have been done and shown that when you can help people that struggle with addiction, and I'm going to say chronic mental health issues too, that when you can help people with community, fellowship, and that means not being judged, not being put down, not having behaviors judged, but when you can actually connect and people feel connected and valued. Rogerian therapy talks about just the human experience of connecting and how healing that is. I don't ever want to underestimate that. And while we're now struggling with COVID-19 and we're all having to go to telehealth, and while it's a wonderful option, I'd rather have someone on a screen I can talk to than no one at all. We'll do what we need to do. There's still something to the energetic exchange from human to human, because we are frequencies and energy, and so are our emotions. And to connect with another person on that level, and to sit with a person while they're in their pain, and to feel that energy coming from them, and for them to share it. As a clinician, when I am talking to my clients and they're in pain, I feel some of that. That comes my way too. And as crazy as it sounds, that shared energetic exchange lightens the load a little bit for the person sitting across from you. And that connection and compatibility in that moment, and I'm not judging them for shooting up or putting things in their body or acting out with pornography. I'm no longer thinking about their behavior, but I'm sharing this energy. That's what's healing. That's what's healing, in my opinion.
Well, it's backed up by neurobiology, neuroresonance, neurosynchronization.
And I don't know why people don't get that.
I think it just takes time, maybe.
Well, I have my own opinions. That's another show. But
that's going to be show number 3. But it's fun to listen to you, because as you're talking, I'm hearing, okay, that's Dan Siegel's work right there. That's Richard Davidson, Rick Hansen, all these people that talk about neurobiology. It's the power of it's the power of connection that helps us heal, and the acceptance. And when you talk, I hear you speak so much of we're all much more alike than we are different, even in our suffering. So I'm not like the person with the food addiction or the sex addiction or the alcohol addiction. Well, not true. We're actually all the same. We're actually really connected. So then the question comes to my mind. It's one of the last ones because it's going by so quickly just talking to you, all this interesting stuff. Is there such a thing as a normie? Someone who's just perfectly normal that doesn't have issues?
The words normal, they're, so I don't like
hear
the
that
word.
because a lot of people, the reason I'm asking, I hear a lot of people talk about that. So some people come in to Healing Springs or other places or recovery, and they're the identified patient, right? The identified issue, the challenge, and they think it's all me. It's all just me. Are other people participating in this? Is the family as a unit part of this? Not a blame, but a name. Is there anything that's we're all trying to go through and work through?
I would say, if people ask me what's normal, I will say there are healthier ways of living. There are healthier ways of expressing your feelings. There are healthier ways of thinking. There are healthier ways of exercise. So I actually like the word healthier better than normal. But what I've seen is these patterns get passed down from families. So unhealthy ways that mom and dad are dealing with pain in their life, that gets passed down to children. The beautiful thing is, can you pass down healthy ways? Yeah, as we all start learning, oh, that doesn't work so well. Oh, I didn't realize that I was contributing to my son's low self-esteem by telling him, you need to suck it up, son. Don't cry. If you start telling your kids not to have feelings, then excessively, if you start to do that a lot, you don't realize that you're actually hampering and hindering their natural emotional expression. So I don't see anybody as being bad or abnormal. They're just doing the best they can with what they've known. But we're learning now that there are healthier ways of dealing with our feelings. There are healthier ways of thinking. I'm teaching parents, and they're going to their children saying, oh, I'm so sorry. I taught you the ways that I was shown, and it's not, it just doesn't work. So it's not about pointing fingers. It's not about judging. It's not about blaming. It's about saying, we didn't realize that the way we were doing this is actually hurting you physically, mentally, spiritually. Let's learn a better way and a healthier way of communicating. So for me, a normie is someone who is working very hard to try to find some balance emotionally, physically, spiritually, mentally. People that are trying to find balance and recognizing it's not, the yin and yang isn't 90% white and 10% black, recognizing there's beauty and life can still be beautiful even in the dark times. So learning perspective, shifting your perspective from thinking you have to have everything perfect, and if you're not feeling good, you're doing something abnormal. That's a dangerous place to be.
Yeah, and I think knowing that can lead us back to healing and recognizing it. You sound a lot like another gentleman I had on the show, Master Montauk Chia, and he's a Qigong, Tai Chi meditation master in Thailand. And he said almost the exact same thing that you said. It's about this balance between the two. We're not trying to get rid of all of our dark side. We're trying to be in harmony with it.
And how do you build the dark side up? How do you reframe the dark side to something that's helpful? I mean, even the word dark side, sometimes people think, oh, it's negative.
Understood.
No, it's still positive. The dark side is just as positive as the white side, the light side. So for someone that struggles with addiction that comes to Healing Springs, instead of saying, oh, the addict part of you is bad. That's a bad part of you. Get away from that part of you.
Yeah.
Don't go anywhere that might trigger that part of you. Disown that part of you. Don't look at that part of you. And clients will say to me, my family hates that part. I hate that part. That part's costing my job, my marriage. I hate the addict me. I'm like, you know what? But the addict you, the reason you're struggling with addictive patterns is because there's pain. And that part of you is trying to help manage that pain and cushion and insulate that pain. So you use to make the pain or the discomfort go away for a little while. And most people will say, well, that's true. I get that, but that's a good thing. I'm like, well, I get it that your drinking has become excessive. You've got a lot of problems with it. It's got a lot of costs associated with drinking. But the intention of that addict part of you is to help manage pain. If we could take, and I said, let's look at the other qualities of the addict self. The addict self is very tenacious, very driven, laser focused, very creative. And they're like, oh yeah, I can come up with ways to get a hold of my drugs, whatever I need to feel better. I mean, you would be amazed at how creative I can be. I'm like, no, really, I get it. Creative, tenacious, driven, laser focused, those are good qualities. If we could take the addict self and those good qualities, heal the pain underneath it so that it doesn't have to overuse overuse food, use alcohol, drugs, stuff that's dangerous, but we could heal the pain so the need isn't there, and couple it with that recovery mind of yours that wants your life to be different, wants to break these cycles, wants to change these family patterns. If we could couple those, that's the rocket fuel that could support the recovery mind that knows you want things to be different. So to reframe that addict self as a positive part of self and to align it with the part of your recovery mind that says, I want my life to be different, this is the fuel that drives this, and the creativity. I mean, you could work a program, do what you need to do, and have a wonderful life if you stop hating the addict self and bring that addict self over to support the recovery self. And so that's a very different way of thinking. Mm-hmm. It's very different to think of the addict self as something good. And for people that already struggle with low self-worth and low self-esteem, you think hating a part of yourself is going to help that? It just makes it worse. So to invite that part in, make friends with that part, and treat yourself as a collective whole and see the value on both sides, that to me is an integrative process where true recovery and identity gets anchored.
And this could be a great segue into another show. Is how do we, now that we've done some recovery work and we're harmonizing these two parts of ourself together and using the addict self to be maybe now the CEO self or the musician self, moving that into optimal performance. I'd love to have you come back and talk about how we could actually do that.
And let's look at people that struggle with depression. What does that mean for them? People with PTSD, what does that mean? People that have psychotic features, what does that mean? What does that look like for that person? How does mental health have a positive side to it? I just reframed addiction. What is the positive? What is the helping side? What problem does the symptom solve if the problem is depression, anxiety, PTSD, and psychosis?
If somebody wanted help and treatment, best way to find you, best way to get this kind of treatment?
I would, Healing Springs Ranch. You can Google us, look up Healing Springs Ranch. There's an admission line. You can call and ask any questions. You can learn a lot about from our website. But if you struggle with substance use disorders, or if you struggle with chronic self-defeating patterns, so whether it's chronic patterns of self-hate, chronic patterns with food that's unhealthy, with gambling, sex, pornography, if you struggle with addictive patterns that are disrupting your life, I think the wellness package that we offer at Healing Springs can really help you work through that and get back to functioning in your life in a healthy way.
And I hope they call.
I do too.
Yeah. Melissa, thank you for being on the show.
Thank you.
So the addict self, the unhealthy self, can be part of our beautiful existence as human beings. We can not only recover from mental health and addiction by unifying these pieces, but maybe even have our dreams come true, reach our full potential. Well, we'll have Melissa back to talk more about that, and until then, we'll see you next time.